Hi everybody, this is Dr. Hinson. I'm here with one of my patients. We're going to do a little demonstration here. She's coming in with some problems with her left hip, and we're going to kind of give you an idea of what we do with Applied Kinesiology to kind of help narrow down and figure out where the source of someone's problem is coming from. So what we're going to do is do some muscle tests. And when we're testing muscles with Applied Kinesiology, I'm not really concerned how strong the muscle is as much as I am trying to find out if the muscle can activate against my resistance. So there's a difference there. Now, what we're going to do with her is we did some pre-tests before we started videoing to kind of get an idea of where her weakest link is right now. And I want to show you how sometimes what we think is the problem, really isn't the problem. Okay, most time when you go see different practitioners, they're going to tell you that, okay, here's your problem, and perhaps if they see a chiropractor, which I have a chiropractic degree, but if they might make some different adjustments to this area and it might actually help some things temporarily. But what we're trying to do is figure out where the cause is coming from. Okay, so we're going to do a muscle testing demonstration, and we're going to test several muscles that stabilize her hip. Now muscles, or muscle testing I should say, is a way to evaluate the nervous system and helps us figure out where weaknesses are, where problems are. And sometimes, as you'll see in this demonstration, she's not necessarily having any trouble in her ankle or in her knee because she's more focused with everything that's up in here. But what's going to end up happening is she's got muscle dysfunction down both in her foot and ankle as well as her knee that isn't necessarily causing pain yet. So muscle testing also tells us just how well a particular body part is going to adapt to stress. And so she's very fit, she's active, she works out every day, she eats well. And so what we're going to do is just kind of give you an idea of how this works. So what I'm going to do is go through and test some muscles. And before we started videoing, we found this particular muscle, the piriformis, as the weakest link in her body at this time. So one of the ways we test that is I'm going to rotate this leg in. She's going to pull her foot towards the opposite wall, and she starts off good, and then she slowly starts to break down. Okay. Some other muscles. That's a muscle that stabilizes the back side of her pelvis. Some other muscles. Pull in tight. That one doesn't work either. If we point her foot down and in, hold that right there. Hold it tight, no way push up. She can't hold that either. So this is a foot and ankle muscle as well. There's another muscle that stabilizes the inside of the knee. Pull your foot towards your head. She can't hold that one. Push her leg out to the window, and that one fails too. And if we bring this leg out here and have her push up, that one weakens also. So a lot of muscles that stabilize her hip and her pelvis are not working. They're not stabilizing this. So when she moves and she runs and does her workouts, she's doing those workouts on a hip that's slightly unstable. Okay, she may not necessarily have any pain yet, but guaranteed it's coming. So the beauty of Applied Kinesiology and the beauty of manual muscle testing is we can find weaknesses, just like she has a weak muscle here in her ankle and some in her knee, and she may not necessarily be complaining of problems here, but I want to show you something. If I have her touch an acupuncture point, there's a specific acupuncture point, and I want you to see what happens. If we have her touch an acupuncture point, which is right here, she's going to hold that while I go back and retest some of these muscles. Hold that down and in. Hold it strong. Now, is that better? Yeah. Pull your foot to your hip. Good. And pull that way. And all of these muscles are now starting to engage. Pull across. Let's do this one here. And push up. Okay, cool. So just to give you an idea, having her touch that one acupuncture point temporarily turned on all of these muscles. And so what that means is that she's got some issues with her hormonal system that need to be addressed, or else these things may not stick very long. We could go make different adjustments to her foot or ankle, her knee, her pelvis, and she might get some temporary relief from that. But if we don't address the underlying hormonal issue, that she's dealing with, then what's going to happen is as she moves and walks, eventually she's going to unravel everything we did. So this is one of the reasons I love applied kinesiology. Applied kinesiology gives us information that sometimes you can't get from x-rays or lab tests, although I use those with my patients when necessary. So now, and after talking with her prior to making the video, she is having some hormonal imbalances, and so we can go about figuring out what needs to be done to address that. So thanks for watching.